chronic back pain is a common complaint in the world. It is also one of the most common reasons for people seeking medical help. The spine is a marvelous feat of engineering. For the thin structure that it bears a whole lot of weight and supports the entire upper body. While usually a sturdy structure, an injury or disease may damage the bones and the nerves inside. Pain is a common way for the back to communicate this damage. Severe pain, particularly that starts abruptly and prevents the person from moving around, should be investigated on a priority basis. Clinicians refer to it as acute back pain. For example, acute back pain can be caused by trauma. The other kind of pain is chronic back pain that is longer lasting, but may not have an abrupt time of onset and may fluctuate in severity. A common reason for such pain is the degenerative disease of the spine. We have explained this in our first part. Go check it out. Some investigations that can be useful in the diagnosis of back pains include an X-ray of the spine, which is usually good at looking for bone injury, for example, fractures or thinning of the bone. MRI of the spine is also performed quite commonly these days. It has a much higher resolution than X-rays and can show the nerves, spinal cord, and the joints of the back in remarkable detail. Sometimes, the nerve conduction study, or electromyogram, may be performed to pinpoint the nerve pinched in the back. As for the treatment of back pain, most people would begin with self-medicating with paracetamol or ibuprofen. This is reasonable as long as the pain is not too severe, is not accompanied by weakness, and settles in 3 to 4 days. Continuing such self-medication for weeks and months can have deleterious effects on health, like kidney injury and stomach ulcers. Before that happens, it is better to seek help from a skilled doctor. Back pain is not a disease itself, but rather a symptom of several other diseases, so the treatment depends on the underlying disease. So, when one does end up seeing a doctor for acute or chronic back pain, the most important task is to rule out a sinister cause. The doctor may decide to treat mechanical back pain where there is no suspicion of a serious disease, with anti-inflammatory medication and physical therapy. Physical therapy can be performed with professional supervision or can be learned and performed at home. If an MRI reveals a compressed nerve or spinal cord within the back, or if the back pain is accompanied by leg weakness, one or both, and with bowel or bladder problems, the person needs to be seen urgently by a neurosurgeon. Surgery may be needed to relieve it quickly to significantly improve the chances of recovery, whether partial or complete. Delaying surgery often leads to permanent injury to the nerves or spinal cord, leading to disability. Often, severe back pain does not either have a cause amendable through surgery or the surgery itself is deemed unsafe due to the poor health otherwise. Steroid injections in the spine may be an option for pain relief. These injections have a high failure rate, and their effect usually lasts 8 to 12 weeks, even when successful. Then it may need to be repeated for pain relief. Prevention is an aspect of the back care that is often neglected. Occupational safety for physical laborers demands teaching them the proper technique for heavy lifting. Staying in shape helps to keep the back healthy by not overburdening it. At the same time, regular exercise can help strengthen back muscles, reducing the chances of further back issues. Remember, back pain is a symptom that has a spectrum of causes, ranging from benign to sinister. Severe or prolonged back pain, particularly in association with neurological symptoms, needs evaluation sooner rather than later. With good care, you can hope to rely on your back for the rest of your life.